Hello and welcome to this week's episode of Clinic Conversations, and this week we are back with Dr. Anderson, OBGYN here at Rapid City Medical Center. How are you doing, Dr. Anderson?
I'm good, Jack. How are you?
I'm doing well. So today we're going to be talking about preconception health. So do you want to just tell us a little bit about that?
Sure. So usually someone would come in for an exam, or a well woman exam, and they would tell me that they were ready to, for instance, try to get pregnant by the end of the year. And so we first would take a basic health assessment, review their medical problems, any medications they're taking, if their smoking history, if there are any supplements they're taking, and maybe their family history, and then kind of go from there. So after a pretty thorough physical exam, and any testing that they might need, like a pap smear or an STD screen, we would assess their risks as an individual. So for instance, if someone had a family history of diabetes, or let's say they've been pregnant before and they had gestational diabetes, we would want to screen them for diabetes. We may check their thyroid. Some of that testing would be based on how they would describe their menstrual history. If their periods are irregular, we would be more likely to do some of that testing than we would otherwise. We would recommend that they take daily folic acid to prevent neural tube defects, and some people think that that might prevent miscarriage as well. Any woman of childbearing age needs to maximize their health in the event that they become pregnant. So at a basic level, general good health principles will always apply. So a balanced diet, they need to avoid smoking and the use of other substances like marijuana. They need to be mindful of their alcohol use. They need to try and maintain a healthy weight, and they need to exercise regularly.
So let's say you have a patient come in and they're taking a medication for some other health concern or health issue. What would you tell that patient?
So, for instance, if they're a diabetic, if they have asthma, if they have a seizure disorder, if they're taking medication for their thyroid, I would tell them not to stop their medication when they find out that they're pregnant, but to let me know right away. For people that have high blood pressure, they should probably let us know before they try to get pregnant, because there are some blood pressure medications that aren't safe during pregnancy, and we would probably put them on something different before they came in for the pregnancy. It's important that they try and maximize their health if they have one of these medical conditions, because, say, for instance, someone has diabetes that needs a little better control. If they control that prior to getting pregnant, they can reduce their risk of a miscarriage, birth defects, and even sometimes stillbirth.
If a patient comes in and they're using birth control, when should they stop using that?
So if they're taking a birth control pill, or they have an IUD in, or they have an Explanon on, if they have a device, we remove the device, or they can stop their birth control pill at the end of their pack, and then they can try to get pregnant as soon as their normal cycle reestablishes. For patients that are using Depo-Provera, which is the injectable contraception, then sometimes I'll ask them to stop that a little sooner, because some people won't have a period for up to a year after they get their last shot. And so if they're trying to time their pregnancy, they may need to stop a little earlier.
Okay. What about vegan and vegetarian diets? Are they okay while you're pregnant? Is there any problems with those?
They just need to make sure they get enough protein. And so however they choose to do that. If they're vegetarians, they can use dairy. Some people still eat eggs, and every once in a while someone will eat a little fish or something like that. But if they're strictly vegan, then they would need to get their protein from nuts and grains and beans and things like that. So.
Okay. How can patients find out more about preconception health?
They can go to acog.org, and there is a lot of patient information on that website, and they can also access the current guidelines for women's health care in the U.S.
Awesome. Well, thanks so much.
You're welcome.